Hi, I'm Dr. Sunil Dachepalli. I'm a senior orthopedic, joint replacement and sports medicine specialist. And today is my favorite topic. I shouldn't say that because ligament injuries, any injury is not something nice. But the reason I have special interest is in this area is we have seen lots of improvements, sea change in the treatment. Now, earlier days, for any types of injuries, the only thing you would do is an X-ray. Have a look at it, there's no fracture, then you're given some splintage, and then you're left on your own. There are instances sometimes, after the splintage is taken off, you would have a wobbly leg or a wobbly shoulder, and sometimes it gives off on their own. And you wouldn't know what to do. There are some centers which specialized, and then they used to have surgeries. And now the reverse is happening. Lots of people are ending up with ligament injuries now. So we are wondering, what is this ligament? We have so many ligament injuries compared to earlier. The reason is now the identification is simpler with what is called ultrasound. That is the probe that they use, and also MRI scan. Now on these, we can identify the ligament tears or the soft tissue tears. So that is how the diagnosis is confirmed. Now, how do we identify? First is any type of injuries, starting from your foot, the simple twist in your ankle. You can have a sprain of the ligament, and then going up the knee joint, then up the hip joint, then your shoulders and the wrist. These are the common areas that you can have sprains of the ligaments. What to do? Wait for 1 or 2 days. Things are not settling, see your specialist. That's utmost. The reason being, most of the ligaments don't need surgery. All it needs is splintage. Give it time and rest so that it heals on its own. So when this happens, what to do? Rise. R-I-C-E. Rest, ice, compression, elevation. Rest. How do you give rest? If it is leg, you need to wear splints and then give it some time to heal. Don't walk around too much or don't toss around too much. Ice. As soon as you see this, apply some ice packs. Anything. It can be a bag of peas, it can be a small ice cube, or you can get a ice bag as such. These sort of things. And please do not keep the ice pack for more than 10 minutes in a particular area. This again, you can have a frostbite, then worsening the situation. So use the ice as many times as possible for shorter durations. That decreases the swelling. Compression. Compression you can give by simpler way, that is called crepe bandage. We have all heard of that. Or the latest generation, they called binders. Like if you take the ankle, we have a socks like thing called ankle binder. To the knee, we can give knee caps or knee splints whilst the ligaments are healing. And for shoulder, we give the shoulder bags. So this is for us to give some time to the particular joint or the ligament to heal. And E is elevation, the most important thing. Now imagine I would get patients, sometimes they say ending up with a football size foot, and I would say, when did this happen? 2-3 days ago. Did you not elevate? Yes doctor, I did, in a pillow. Sometimes you might use a smaller pillow that, when as soon as you put your foot, it is compressed. The main aim is the injured area. If, for example, if it's the foot, should be above your heart level. Anything, any injured area should be above your heart level, like your foot. Or imagine if I injured my hand, it should be like that or up that way. Keep moving the fingers. So any injured area should be above your heart level. So the gravity will act and that will drain the swelling. Now once this rise treatment is given, you can approach your doctor and he can prescribe some painkillers or something to decrease the swelling, thereby alleviating your problems. Try to wear the splints whilst you're doing your work as much as possible so that the ligaments are given time to heal. Now, if you take, for example, in the ankle, there are 2 ligaments that will heal majority just with conservative management, that is without operation. If you come up the knee joint, in the knee joint you have 4 ligaments, like 4 pillars. Most of them, like 3 of them, heal on their own, that is MCL, LCL and PCL. But there is one ligament called ACL, that is anterior cruciate ligament. This doesn't heal most of the times. So this needs some type of treatment to that. If it is a partial tear, we can do strengthening around the knee joint. If it is a complete tear, we have to do what is called reconstruction. That is, it is not a repair. That's what you should remember. Very, very few ligaments we repair in that ACL. Now, if you take my experience, for example, the numbers I've operated in London for 10 years that I stayed there, and the numbers I've operated in India for the past 7 years. In India, it's almost like double the numbers compared to London. The reason, youngsters on bikes. So we have these bikes going at faster pace, sudden slamming the brakes, and then you fall down by twisting the knee. You also have sometimes, it's not your mistake, you have somebody suddenly slamming their brakes or somebody coming on the opposite side. It's unfortunate. So anything to do with the accident. We have lots of bikes compared to Western world. So the chance of having injury is high. As you sustain the ligament injuries, you want to first get assessed. Now, if it is the other 3 ligaments in the knee, majority will heal on their own if you give time. That is at least 6 weeks. Now, there is one ligament called ACL, like I was saying, that needs surgery most of the times. There are people who didn't have surgery but doing well. Those people are having the muscles really bulky. That is, if you take footballers, if you take rugby players, they have very bulky muscles. So these keep the joint stable, because even though the ligament is gone, the muscles are taking care of the function. But whereas in our scenario, we need something to stabilize. So we have to go for stabilization surgery. Otherwise, the knee will be wobbly and you'll have rotation, and then you will end up with early arthritis. So ACL. Now going up, then the shoulder. In shoulder, there are some ligaments that will heal on their own. And there is one called labrum. That stabilizes the ball from coming out. So that needs some time, and most of the times it will heal on its own. Very rarely you might feel that the joint is unstable in spite of giving some time. So that is, the labrum or the soft tissues around have not healed. In those scenarios, again, we do the keyhole surgery to stabilize the joint. Now, most important, you want a stable joint so that you can function properly. If you can't, every day is like hell. You are remembered about that, and your concentration mainly on that particular area rather than your day-to-day activities. So if you have any of these ligament injuries, like I said, to summarize, simple thing, give it some time. RICE, that is rest, ice, compression, elevation, simpler tablets from your local doctor. Things are not settling, see a specialist, get investigated. Majority will settle without surgery with splintage. Still not settling, go for a keyhole surgery. Nowadays we do lots of keyhole surgeries. Earlier days we used to do big cuts. Now it is just one tiny half a centimeter cut that we put the camera in and treat the problems. Have a good day.